And I tell you, our next speaker is an incredible man. He's simply one of the most inspirational people I have ever met. I tell you, I was in Toronto at a conference, and I had a chance to see Philippe Lucas speak, and he has forever burned into my mind a very important message. You matter. Your life matters. And he acts like it. He's a man who's the very definition of being congruent. He has a tremendous heart. He's a scientist. And you know, guys, he was there in the front lines decades ago when people were dying, people were suffering, and they had very little in the way of options, places to go. Philippe made sure that people had a safe place to be, a place where they were welcomed, a place where it was all right to suffer and to ask for help and to be treated with compassion and kindness. And he has inspired countless others through his work, through his research. And thankfully now today, he is with a wonderful company with tremendous potential to do great good, not just in Canada, but to extend that footprint. So officially, I'd like to welcome Philippe Lucas. He's the Vice President for Global Patient Research and Access at Tilray, an international leader in medical cannabis production, research, and distribution. They're based in Nanaimo, BC. He's also a graduate researcher with the Canadian Institute for Substance Use Research. His scientific research includes the therapeutic use of cannabis in the treatment of mental health conditions and addiction. And he's been invited to provide expert testimony before the Canadian House of Commons, the Canadian Senate, and the BC Supreme Court. If you have not seen this recording, do yourself a favor, go on to YouTube, put his name in. You should have seen this man's performance in front of those government hearings. He was the most well put together, well-spoken, research-based, evidence-based, passionate, driven individual. And he gave an outstanding presentation to some very appreciative folks in the government. Philippe first became involved with medical cannabis as a patient, and he founded the Vancouver Island Compassion Society in 1999 to serve the needs of patients who might benefit from the medical use of cannabis. He's extremely community involved and serves as a Victoria City Councillor and Regional Director from 2008 to 2011. Philippe has received a number of accolades and awards for his work, justifiably so, including the Queen Elizabeth II Diamond Jubilee Medal in 2013 for his work and research on medical cannabis. Please join me in welcoming Philippe Lucas.
Thank you all so much. It's really great to be here. I was so pleased this morning that you guys somehow avoided the snowstorm that hit Calgary so hard, although I did see trails of salt leading to the plane to get here today. I was a little bit late because our flight was coming in from Calgary. I really want to thank Michael for organizing this. I want to thank the speakers that came before me, MJ and Terry Lake, two of my favorite folks to present with, and Zach Walsh, who's going to be coming up next. This is really a great gathering. I find myself on panels a lot with these folks these days because we share a commitment to improving the lives of patients across Canada, and more we're being looked at because we, through evidence gathering and otherwise, believe that cannabis can play a role in interrupting the opioid overdose cycle. As has been mentioned by MJ and Michael, this is not going to be the ultimate solution. It's not going to stop overdoses across Canada on its own. But it's hard to deny with the amount of evidence that we're saying that cannabis can't play a role in helping reduce the public health and safety impacts of opioid overuse and overdose. So today I'm going to start out with a brief introduction to my employer, Tilray. We'll talk about the Tilray Research Program, and then I'm going to talk about medical cannabis and the treatment of pain and mental health. I'm going to share some data, some unpublished data from that's going to look at the substitution, the use of cannabis as a substitute for opioids and other substances. And as Michael said, I guess we're going to hold questions till the end. I'll look forward to your questions. So at Tilray, our mission is improving lives through medical cannabis. We do that by conducting methodologically sound clinical and observational research, by improving patient access, educating and increasing awareness with physicians, and then registering Tilray products with regulatory authorities in Canada and more internationally as well. We've got a $30 million facility in Nanaimo, BC. It was the first GMP-certified medical cannabis production facility in North America. And what that means is that the cannabis being produced there is being produced at the same high standard as traditional pharmaceutical drugs that you or your patients or the folks that you work with might be using otherwise. We've got 275 full-time staff there, and we're currently using that facility to export product into 11 countries on 5 continents right now. Ironically, outside of Canada, most of the medical cannabis programs around the world are doing distribution via pharmacies. So certainly we hope to see that happen over the next few years here in Canada as well. But it's interesting to note that if you're in Australia or New Zealand or Chile or Germany right now, you pick up your cannabis products at the pharmacy. Cannabis products produced right here in BC or across Canada. So really interesting that we haven't quite caught up with that despite being a leader in medical cannabis production and research internationally. We've got a number of different products available, extracts as well as ground flower products. And most importantly, we like to tell it like it is. And so that first number identifies the THC, either percentage or milligrams per mil or milligrams per capsule. Whereas the second number identifies the CBD content of these same products, so that if patients are using medical cannabis, they're able to do so knowing exactly what they're using to have a predictable outcome from one dose to the next. And we've recently got a partnership with Sandoz Canada, which is the first major partnership with a traditional pharmaceutical company of any cannabis company around the world, which we hope will increase the level of confidence that pharmacists, physicians, policymakers can have in supporting the use of medical cannabis and ensuring that it's treated like a medicine rather than still continuing to be stigmatized, which has been the history of this use, unfortunately, to this point. And we know that medical cannabis is really tricky at first, that people who are not familiar with it may have concerns around the right way to dose it. And so we've developed these dosage guidelines to help patients, physicians, and pharmacists work with medical cannabis with always the guiding principle that you should start low and go slow when it comes to medical cannabis. Start at the lowest possible practical dose and slowly increase the dose until you get to a dosage window where you've got positive effect without negative impacts. And so these are available right now through Tilray, and we hope it eases the path to folks who might be considering this as a treatment option. I wanted to start by telling you guys about the current legal landscape. Right now there's about 300,000 Canadians using cannabis through our federally authorized medical cannabis program, but it's still a tiny minority of the actual Canadians who claim to be using cannabis for medical purposes. When we do national polling, about 1 million Canadians claim to be using cannabis for medical purposes. So that means that the majority of patients out there are still using it without getting protection from arrest and prosecution, and maybe because their physician is not willing to consider prescribing it. We still have issues with the Canadian Medical Association and some of the provincial colleges. Really raising a lot of red flags around medical cannabis, despite the fact that, of course, when you're comparing its potential harms compared to traditional pharmaceuticals, not just opioids, but benzodiazepines and a lot of other drugs, it's considerably safer by any measure. On the horizon, we've got legalization, a mere 14 days from now, taking place in Canada. I'm so proud that our country is leading the way in this, that we're about to take a public health-centered, harm reduction-informed approach to cannabis policies, moving away from policies based on fear, misinformation, and prejudice towards policies based on kindness, compassion, and common sense. We've got the regulation of non-smoke forms of ingestion, such as edibles, vape cartridges, concentrates, that'll happen within a year of October 17th. That's a self-imposed mandate the government's given itself. And I think that'll make a big difference because we know that with patients and recreational users, non-smoked forms of ingestion like cartridges, vaporizer cartridges, and edibles are increasingly popular, but those will not be available at our at our local stores. And I know Kamloops is going to be hosting the first BC government store, which is really exciting, I think, when this kicks off in a few weeks. But you won't find vape cartridges or edibles there. Folks who want those will still continue to buy from the black market and potentially an untested, unlabeled supply. And then pharmacy-based access. This will come in Canada. Every major pharmacy chain in Canada is lobbying for it. You might have heard or read recently that Shoppers Drug Mart just got its license as a licensed producer, and they will be distributing cannabis online in the coming weeks and months. You'll be able to use your Optimum card to buy medical cannabis and get Optimum points. So if that's not the sign of, us coming a long way in the last 20 years, that's pretty remarkable as far as I'm concerned. And I'm bullish on it. I think that other pharmacy chains and regulations will be in place to allow pharmacy-based access within the next, let's say, summer 2019. And I have to tell you, in over 20 years of working on medical cannabis, nothing that's taken place so far in terms of regulations is going to do more to destigmatize the use of medical cannabis and making it available like every other traditional pharmaceutical out there. We still have some challenges in that patients are being taxed for medical cannabis, and they're actually going to be subject to the excise tax, an additional 10% tax being imposed on recreational cannabis in 2 weeks, so that patients will pay PST, GST, and now this excise tax. And in fact, I'm leaving here tomorrow to go to Toronto to meet with the Senate committee that's taking some depositions before our for the budget 2019 to urge them to finally do what's right, remove the taxation of medical cannabis, remove the excise tax, remove the GST, remove the PST. Let's stop taxing patients under the understanding that cost is a continued obstacle to access for medical cannabis patients across Canada. So Tilray is involved in a number of clinical trials. It's a really distinguishing feature. We're really committed to the research on medical cannabis. We've got a phase 2, phase 3 trial on chemotherapy-induced nausea and vomiting taking place in Sydney in cooperation with the Government of New South Wales and the University of Sydney. We've recently finished a study of pediatric epilepsy at Sick Kids Hospital, Canada's premier children's hospital, which showed a remarkable reduction in seizure frequency and intensity for the 19 kids who finished that study. We've got an ongoing study of PTSD. It's a phase 2 clinical trial with UBC. It's actually taking place in Kelowna at UBC Okanagan, and my colleague Zach Walsh will be up here later as the primary investigator in that study, and Ian Mitchell is the qualified investigator or QI in that study. It's been great working on them over the last few years on this, and over the coming weeks we're going to be announcing a new site associated with that study in Vancouver to speed up the recruitment and completion of that study. We've done a study of chronic obstructionary pulmonary disease at McGill University, and recently we've announced that we're doing a study of essential tremors at the University of California, San Diego. The really exciting part about that is that Canadian medical cannabis products are going to be imported into the US to do research on medical cannabis. So, and we're also going to be announcing in the coming weeks studies on cancer, anxiety, and alcoholism. On top of that, we do a lot of observational research, and part of my role at Tilray is to lead this research, and so I'm the primary investigator in these 4 studies, and all of these studies are informed by the data showing that cannabis can play a role in impacting the use of other drugs. Last year, we did the Tilray Patient Survey. It's the largest survey of Canadian patients to date at 2,032 responses. We've got 4 publications under review based on that. 3 of them are focused specifically on substitution effect. One of them on cannabis as substitute for tobacco, which is really exciting as well. The Tilray observational patient study is the largest longitudinal tracking of medical cannabis patients across Canada taking place right now. And today I'm going to be sharing some preliminary data from that study with you guys, and I'm really looking forward to that. We've got, more recently we launched the Substitution of Opioid study, which is similar to some of the research that MJ and the BC Centre for Substance Use is doing. We're specifically looking to see if cannabis can help improve the success rate of methadone and Suboxone treatment as measured by retention and adherence in the first 6 months. So we're comparing 250 patients who are starting methadone Suboxone treatment without medical cannabis to 250 patients who are starting it with medical cannabis, because of course if you can increase the success rate of medical cannabis, you can absolutely save lives, because patients are never more vulnerable than when they fail out of methadone or Suboxone. They go back into the illicit drug supply contaminated by fentanyl and carfentanil with their tolerances lowered because they've been off those drugs for some time. That is when you have the biggest risk of overdose. And so if we can increase the success rate of methadone, Suboxone, and other treatment options, you can definitely save lives. And then in the next couple of weeks, we'll be launching the medical cannabis in older patients study, which is going to be the largest national tracking of cannabis used by patients 50 and over. We're really excited about that as well, because seniors are one of the fastest growing groups of medical cannabis patients in Canada. We know very little about how they're using medical cannabis. It seems to be enhancing their sex lives. I just hear a lot about seniors having sex these days. So we'll look forward to, we're doing some tracking on that as well. So right now I'm going to shift gears, and I'm going to share with you guys the results of the Tilray observational patient study. I say the results, but it's really the preliminary data from this study, because it's an ongoing study right now that has over 1,900 participants in 5 provinces at 20 different medical clinics across Canada. It's a really simple study. It's looking at medical cannabis and its impact on quality of life as measured by the World Health Organization Quality of Life short form, and prescription drug use. And the neat thing is that the prescription drug use data is actually filled in by the physician at each of these clinics. And it's filled in at baseline, and then at 1 month, 3 months, 6 months, and 12 months. So you get to move away from the perception you might have recall bias. Because if you ask any patient on any given day, what prescription drugs did you use 3 months ago or 6 months ago? If you ask me what prescription drugs I was using 3 months ago, I'll say the little one, it's yellow. I don't know. And so by having the physician fill in that data, we get much more accurate data. And so today I'm going to be sharing data from the first 573 participants in that study that did at least 1 month follow-up as of December 1st, 2017. And the analysis was conducted by UBC, a group called CHAOS, the Center for Health Evaluation and Outcome Sciences. And they've got a lot of experience in studying these kind of large, complex databases. So the first thing I want to share with you guys is a bit of demographic data. So this is a group of patients that's 55% female and well-educated. I'm sure those two things are not a coincidence. But I want to note this because this is the first time in about 15 years of doing medical cannabis research that I've seen a group that was more female than male. In fact, typically within our medical cannabis program in Canada, there's a 2-to-1 ratio of the number of men instead of women using medical cannabis. There's no real good reason for that, except that men are more criminogenic. We're more likely to break the law. So we're kind of early adopters to these more stigmatized medical treatments. But we're seeing more and more women come to medical cannabis. And one of the reasons for that is that there's a lot of conditions with a higher prevalence in women, such as depression, anxiety, migraines, MS, lupus, fibromyalgia, that don't respond well to traditional pharmaceutical treatment, that do seem to respond well to medical cannabis. So I'm really encouraged, and I think that within the next year or two, we're actually going to see gender parity in our medical cannabis program if these rates continue at this rate as well. We see that the average age is 49 years old, and in fact, 70% of respondents were over 40 years old. So there's still this perception in the public, I think, that medical cannabis is just being used by 18-year-old guys sitting in a basement playing video games, getting doctors to fill out their scripts to legalize their recreational cannabis use. And I can tell you that in over 20 years of working with patients, what I typically see are middle-aged individuals who've had treatment failures, who are looking for an alternative to traditional pharmaceuticals. And certainly this population seems to reflect that. We also see that 54% are married or equivalent. I'm a married man. I'm not sure there's an actual equivalent that you can have to that. But it does suggest that this is a very stable patient population. I always ask the same two questions when I do this kind of research. What's your primary condition? And you only get to check one box. What's the main reason you talk to your physician about using medical cannabis? And then I ask, what are your primary symptoms? And you get to check multiple boxes in that case. And since we're doing a lot of recruiting for this study at chronic pain clinics, it's no surprise that chronic pain really jumps out as the #1 primary condition. But when you look at the symptom breakout, you see chronic pain again at #1 at 78%, but that's closely followed by insomnia, anxiety, stress, depression. So suddenly you start to see this knot of chronic pain and mental health, which is often so often a comorbidity. It's so common to see people with long-term chronic pain conditions develop insomnia, anxiety, stress, depression as a result of that long-term chronic pain condition. And sometimes the inverse is true as well. You see patients with long-term mental health conditions that develop chronic pain as a comorbidity. And it's a tight knot. And about 80% of patients in Canada are using cannabis for either chronic pain or mental health conditions. You also see a lot of appetite loss and nausea, sometimes to do with chemotherapy treatment, HIV/AIDS, or Hep C. As well as spasms like Parkinsonian diseases, epilepsy, MS, and GI disorders like Crohn's, colitis, IBS, IBD, all very common reasons why patients cite that they use medical cannabis in Canada. And in terms of the amount used per week, when they're using flower, it's about 1.27 grams per day. And it's usually used once or twice a day. So it's not a lot. This is very consistent with data gathered in the US, Europe, and internationally, suggesting most medical cannabis patients get by with about 0.5 to 1.5 grams per day if they're using it daily. And most of these patients, by the way, are using cannabis daily, but pain and mental health conditions are daily chronic conditions with daily chronic treatments, so it's no surprise that medical cannabis patients using for those conditions are using their products daily. This is a question that I often get asked by physicians. They say, well, when you start using medical cannabis, do you increase the dose? Is it something like you're always having to up the dose? And my experience as a patient, because that's how I started with this, and in working with patients, is that most patients tend to stabilize their dose. They don't need to increase it. While you develop a tolerance to the side effects of medical cannabis, including tachycardia, the red eyes, the dry mouth, and even the disorientation and some of the impairment associated with medical cannabis, patients tend not to develop a tolerance to the therapeutic effects of cannabis. And you certainly see that here. You see that the naive patients, whether you're looking at the medium or the mean, really don't increase their dose from month 1, which is when they started using it, or week 1, to month 6. And you see a slight increase in the use by experienced patients, but overall you see a very steady and stable dosage regime over the first 6 months. And in terms of primary method of use, oral ingestion in this case is the #1 cited primary method of use, beating out smoking, vaporization, which is quite remarkable. This is the first study I've ever done that has found oral ingestion to be the primary method of use and high CBD to be the preferred type of cannabis. And this marks a sharp, a significant shift away from the smoked ingestion of high THC cannabis that dominated our federal medical cannabis program for its first 15 years of existence. So it's really interesting to see that non-smoke forms of ingestion account for 60% of use and that high CBD is being used most often. Now, when I do sub-analysis and do surveys specifically to patients using extract products, they tend to say that they prefer the high CBD product. When people are smoking or vaporizing, they tend to prefer higher THC. When it comes to to extract products, they prefer high CBD. And patients often report using a high CBD product during daytime and then a higher THC product at night, so they can sleep off the impairment. And because the orally ingested CBD products are good for a daytime workplace setting. They're very discreet. You don't have to worry about impairment. And then for overnight relief, it can be effective to use higher THC products. So you don't have to worry about the impairment during the day. And, as part of my work as a researcher in the Canadian Institute of Substance Use Research and Tilray, I've really focused my research over the last 10 years or so on the use of cannabis as a substitute for other drugs. And so I'm going to share some data on that in the next few slides. So this is an examination of the percentage of patients using opioid and non-opioid pain medications, using antidepressants, anti-seizure drugs, benzos, and sleep aids at baseline, which is the first bar you see here, to 6 months. And what you see is statistically significant reductions in the use of all of these medications from baseline to 6 months. And when you look specifically at opioids, you see that at the start of this study, 32% of participants were using opioids, and that by 6 months, that was reduced to 13.6% of participants. In fact, the odds ratio of using opioids at 6 months was 0.12 compared to baseline. That's how significant this impact was. And now I wanted to make sure that patients weren't graduating to using opioid use as well. When we talk about cannabis as a gateway or an exit drug, we need to make sure it's not, opening up the door to anything else either. And what we saw is that while the number of opioid users at baseline declined by 61% at 6 months, only 3.8% of non-opioid users converted to opioid use by 6 months. So it certainly doesn't seem to be leading people to increase the chance of opioid use. And in terms of the actual dosage, we used something called the morphine equivalency scale, which allows you to compare low-grade opioids like codeine to high-grade opioids like carfentanil and fentanyl and methadone. And what we found was that the average opioid use went from 187 milligrams per day at baseline to 48 milligrams per day at 6 months, a 74% reduction in opioid use in the actual milligrams per day dosages. And yet, at the same time as we saw this, we saw statistically significant improvements in all 4 facets of quality of life, with the greatest changes being in physical health and in psychological health. And although we did see some changes in environment and social relationships, they were lesser changes, which we think increases the internal validity of the study, because we wouldn't expect to see significant changes in environment or social relationships, at least not at the same rate as we would psychological and physical health, by simply introducing medical cannabis into the course of care of patients. So basically, it's a very simple message we're getting from this data. Patients use medical cannabis, whether they're cannabis naive or not, once they get a standardized supply of medical cannabis from a source that provides accurate data on the potencies and a standardized, replicable supply. So whether they're naive or not, they cut down on their use of prescription drugs, and their quality of life improves. So really significant findings from that point of view, and hard to deny that this wouldn't have some kind of impact on the potential harms and the escalation of use of opioids if you can actually get people to quit using opioids and using cannabis instead to treat chronic pain and other conditions. Now, we're not the only researchers who have found this. You've heard from MJ today. You've heard some data also from Terry. MJ mentioned the Bacubarinol study, but I also want to mention the Bradford and Bradford study from 2016. There's another publication in 2018 as well that showed an 11% reduction in prescribed opioid in opioid prescriptions for seniors who were on Medicare Part D in medical cannabis states following the introduction of medical cannabis states. And even here in Canada, where Veterans Affairs Canada covers the cost of medical cannabis and other prescription drugs, we've seen a lot of concern over the increasing use of medical cannabis by vets, police, military, and correction agency vets. But at the same time as we've seen this near hockey stick increase in the number of vets using medical cannabis, we've seen a 43% decrease in the number of vets using benzodiazepines and a 31% decrease in the number of vets using opioids. So really remarkable data there as well. So in conclusion, medical cannabis is primarily used in the treatment of mental health and chronic pain. Medical cannabis patients commonly substitute cannabis for opioids and other pharmaceuticals, often leading to complete abstinence. And Tilray produces a standardized source of GMP medical cannabis product, and we're conducting research to better understand the impacts, positive and negative, of medical cannabis on end user experiences. So thank you so much for your time today. I'll look forward to your questions later. And once again, thank you to Michael and the team for having me here. Thank you.
Thank you very much, Philippe. I'll just grab your yeah, we'll pass that along. There we go. Wow, what an absolute privilege and a pleasure to be sharing the stage with you, Philippe. Thank you very much. I hope you're seeing a bit of a trend and a pattern here, and that we are focusing on the evidence. We are paying attention to what the research is showing us, and as a first step towards informing public policy and trying to find the best ways that a community can respond to the challenges that we're faced with the impact of opiates and other problematic substance use, we must begin with education. We must begin with research, and we need to know where we stand so we know where we're going. We also have a lot of misunderstanding, and I think it's incredibly important, and why I'm so thankful that we have such wonderful people bringing their information to share today with us, that we get insights into the clinical research. We get insights into the process and the understanding of the thinking behind the data that's being collected, so that we collectively as health professionals can better understand ways to create meaningful interventions, ways in which we can see those statistics improve, and that burgeoning feeling of hope that there's a way that we can save lives. We can stoke that fire. We can join together, share our research, our knowledge, and our experience, and help one another to make inroads in this extremely challenging problem.